Okay, thank you. Good afternoon, everyone. Welcome to House Human Services. This afternoon, as part of our ongoing efforts around oversight and accountability, we are going to take up an update on the Overdose Prevention Center that was approved and is in law from last session. We're going to hear an update from Dr. Mark Levine, and then we are also going to hear from Joe McGee, who's the Deputy Chief of Staff at the Mayor's Office in the city of Burlington, just to refresh people's memories and also to, for those people who weren't here, there was one overdose prevention site that was authorized by the legislature last year, specifically in the city of Burlington. So before we get started, we'll do introductions around the room. So for people who are not accustomed to being in the House Human Services committee room, we introduce everyone. So my name is Teresa Wood. I represent Waterbury, Bolton, Buell Score, and Huntington.
My name is Ray Garapano. I live in Essex. I also represent Essex Junction.
Jubilee McGill, and I represent Bridport, Middlebury, New Haven, and Weybridge.
I'm Esme Cole, and I represent Hartford.
I'm Zon Eastis. I live in Guilford, and I represent Guilford and Vernon.
I am, excuse me. I am Todd Nielsen. I represent Brandon and Forest.
Representative Brenda Steady. I represent Milton, East Milton, Westford.
Doug Bishop, representative from Colchester's Chittenden 20 district.
Good afternoon, Representative Eric McGuire, Rutland City.
Good afternoon, Dan Noyes. I represent Wolcott, Hyde Park, Johnson, and Belvedere.
All right, we'll start around the outside with our committee assistant.
Lori Morse, committee assistant.
Okay, folks, action circles. Candace Gale, Director of Community Relations with B4.
Jill Sudhop Karen from Vermont Medical Society.
Natalie Lyle, Vermont Department of Health Policy Advisor.
Right around.
Cecily Day, I'm interning with Dotson Member.
Amy Johnson, Vermont Care.
Have the press introduce themselves as well.
Ola Bergeson, WPTC.
Thank you. Okay, and now we'll move to folks on Zoom. Commissioner, why don't you start off?
Yeah, I'm Commissioner Mark Levine, Department of Health. And it would only be appropriate for me to introduce the next person, who is Jessica Schifano. She is our new policy director for the Department of Health. So over these ensuing days and weeks, you'll have the pleasure of meeting her directly.
Thank you. Jessica, you want to say anything yourself?
Yeah, good afternoon, everyone. It's nice to meet you virtually and look forward to meeting you all in person. And as Dr. Levine said, I am the policy director at the Department of Health and look forward to working with all of you throughout the session. Thanks.
Thank you. So for returning members, are you in the position that Brendan Atwood had previously?
Yes, that's
yes,
correct.
I'm seeing nods. Okay. And Joe.
Good afternoon, everyone. My name is Joe McGee, and I am the Deputy Chief of Staff for Burlington Mayor Emma Mulvaney Stanek.
Thank you. Okay, so this afternoon, as I mentioned, we're going to concentrate on an update with regard to implementation of the bill that passed last year, creating Overdose Prevention Center in the city of Burlington and the Department of Health's roles and responsibilities that are laid out in that bill. And then we'll get an update on the process that's occurring between the Department of Health and the city of Burlington, and then look to Mr. McGee for an update about what they're looking at in terms of implementation. So Dr. Levine, the floor is yours. And just as a reminder to committee members, if you want to ask a question, just please direct your attention to me and I will recognize you. Thank you. Oh, Dr. Levine, you're frozen, I think.
Yeah, he is.
Jessica's not. Oh, looks like he's going to come back on.
We probably all have had that one time or another.
Yeah, technology is great when it works. Well, in the meantime, while waiting for Dr. Levine, I'll be sending out budget assignment pairings for y'all today. And then we'll spend a bit of time over the next couple of days at various points you'll see on the agenda, reviewing what that really means. Okay, so what I've tried to do is to pair a legislator who has been here previously with a person who is new, and luckily that all works out. We've got the same numbers. I'll be a resource for all of the teams, and we'll talk about what that means to be part of a budget team. And so look for that in your email a little bit later today. Okay.
Budget for just human services or the entire budget?
Budget for each team will have an assigned either full department or a particular section of a department. So DCF, for instance, is a very large department. There are 3 teams assigned to DCF. Dale has 1 team, and BDH, Vermont Department of Health, has 1 team. So those are the 3 departments for which we have jurisdiction. So we'll be looking at budget for those 3 departments.
Okay. Oh, he's back.
Hello, Dr. Levine.
Was that on my end or your end?
It was on your end. I think because you were the only one who was frozen, though. Jessica was okay. I don't know if she's in the same building where you are, but anyways, but we're glad to have you back. Thank you for signing back in.
Are you ready for my testimony?
Yes, the floor is yours.
Thank you. So again, Mark Levine, Commissioner of Health. I would love to be there in person with you. I was challenging to be at providing a national presentation and then immediately showing up in the committee room in the state. So we'll have plenty of time for congregating together in the future. So I will limit my comments to 3 areas, and they will be the publication of the guidelines for overdose prevention centers, the grant proposal process, and the evaluation process. So starting with the prevention center operating guidelines, these were published on schedule on September 13th of 2024. As you know, it's built into the legislative requirement of Act 178. This is not a rulemaking process. This is guidance. And we've been very clear about that throughout the process. But having said that, people have looked at this quite seriously and taken the guidance as really things that need to happen. So the impact is stronger than perhaps the word guidance. Most of the guidance addresses operational needs, not necessarily some of the external factors like location that are part of the process of the city. And obviously, Burlington's grant must adhere to the guidelines. And should there be any other overdose prevention center operating in Vermont in the future, they must adhere to these guidelines. Though we had some experience in other countries to draw upon in terms of established overdose prevention centers and the guidelines in place for them, people must recognize that other than 2 sites in New York City for on-site and a newly opened site in Rhode Island, which at the time we were pulling our guidelines together had yet to open, there were really no United States sets of experience to draw upon. So we did draw upon these other sites in the country in consultation with them. We also drew upon the expertise of staff from syringe services programs, recovery centers, the Drug Policy Alliance, the Vermont Center for Vermonters for Criminal Justice Reform, Burlington City, the Medical Society, and researchers that have been actively following this area from NYU and Brown, and who are currently evaluating the sites in New York City and Rhode Island. We also developed this in consultation with a number of other stakeholders, including legislative members. At the time these got published, we had a wide variety of forums to really have very comprehensive discussions all around. And mostly, I have to say, quite candidly, received tremendous support and accolades for what we published, as opposed to major controversy. Second area, we did extend an offer to meet with City of Burlington to answer any questions regarding these guidelines and review the standard requirements that are included in the standard grant provisions for when a community develops an overdose prevention center proposal. The Department of Health and the City of Burlington will be meeting exactly 1 week from today to discuss progress to date, which I'm sure Joe can update you on in his part of the presentation here. And review any questions that they have related to the guidelines and the proposal process. But to be clear, we have not yet received a grant proposal from the city, which means that at the present time, we have not really awarded the $1.1 million from the Opioid Abatement Special Fund to the city, because that is contingent upon receiving a submission of a grant proposal. And that again is in Act 178. I know that the Burlington, the city has announced the hiring of a special assistant on overdose prevention center implementation, and I won't steal the city's thunder from talking about that in their presentation. And then lastly, I again just wanted to touch on evaluation, because that's an important part of what needs to happen within the guidelines and within the legislation. And indeed, some supplemental money to the tune of $300,000 was provided for an evaluation component. So the Department of Health has contracted with the Pacific Institute for Research Evaluation, PIRE, P-I-R-E, and we did that in September to assist with the first OPC evaluation report, which I believe has gone in today and is due tomorrow. They're supporting the department in a potential partnership with an acronym known as SAFER, which stands for Study Assessing the Effectiveness of Overdose Prevention Centers through Evaluation Research. That's a collaboration between the aforementioned bodies, Brown University and New York University Grossman School of Medicine, because they are funded by a National Institute on Drug Abuse grant to evaluate the effectiveness of overdose prevention centers in New York City and Rhode Island. So if we can achieve this partnership, SAFER can then evaluate the effectiveness of the Vermont OPC pilot program side by side with these other two. The really important partnership, and is of note because the work will inform future reports on the impact and effectiveness of Vermont's overdose prevention center pilot program. SAFER expects to hear if the proposal to include Vermont in the evaluation has been funded by the NIH next month. So we'll know at that point in time. But as I stated, the first evaluation report is filed and in now. It's very much a baseline data setting document to know where we are in the state with regard to opioids at this point in time. So those are the three areas I wanted to cover. I'm certainly happy to expand and answer questions on them or anything else, but I'll stop there.
Thank you, Dr. Levine. Could you stay again? The voice is a little bit muffled on this end. I don't think it's anything having to do with you. It's technology in the State House right now. But what was the name of the organization that you've contracted with?
So it's PIRE, P-I-R-E, Prevention Center, Pacific Institute for Research and Evaluation.
Thank you.
Aside, we've contracted with them for other things in the past, very, very effective.
And they're working to be able to include, and you as well, working to be able to include Vermont's pilot in the SAFER project being conducted by Brown and NYU?
Exactly. This would be a partnership amongst us all, should the funding come in at the federal level for SAFER.
Okay, gotcha. Thank you. Members, questions? Representative, go ahead, Representative.
Thank you, Madam Chair. Good to see you again, Dr. Levine. You had mentioned that there were several agencies and individuals that have been important in driving how some of the protocols and procedures are being put together in regards to this site. By any chance, has there been any conversations with any representation from the National Health Institute, SAMHSA, or the American Society of Addiction Medicine?
I want to say yes, because we're always in consultation and discussions with them. They don't have, the current experience with these sites. So I'm not sure that they were as powerful as the other partners that I mentioned. Are you wondering about just on the general topic or on the guidelines themselves?
On the guidelines themselves, as we are all aware that all three of those agencies that were just specifically mentioned, this is not a piece of their harm reduction model at this time. So that's why I was expressing whether or not there's been any consultation with those governing agencies in regards to what we are attempting to get into place. Because I believe it should be driven by, our nationally recognized standards.
So to be clear, I'm absolutely certain that as my teams have discussions with them, because they are funding agencies for many other activities in our Division of Substance Use, this has come up, but I strongly doubt that they had any role in really the guideline setting themselves.
I appreciate it. Thank you.
Other questions from members? Go ahead, Representative Bishop and then Representative Steady.
Thank you. Commissioner, did I understand correctly that part of the intent being involved in this evaluative process is not only for our own purposes, but it may help lead to some federal dollars down the road?
No, I did not say that. The federal dollars are mostly to fund the research on the effectiveness or lack thereof of the Overdose Prevention Center in Burlington, and provide some ability to have a comparison with Rhode Island and New York City, which are just a little ahead of the game in terms of timing. But no, not your other intent in your question.
Thank you.
Representative Steady.
Because I wasn't involved in this, I was understood, it's my understanding when this was implemented, that the monies used for this was the $2 million from the opiate settlement.
It's the monies that are funding this are coming from the opioid settlement.
So what happens when that 2 million is done?
The bill specifically says that money would be appropriated until 2028.
I see, I didn't see that part of it.
Yes.
Okay.
Thank you.
That'll come out of the general budget and taxpayer funding?
At this point in time, this is considered a pilot. And so that's the purpose of the research. And so, I would expect future legislators and future representatives from the health department to be making recommendations about that. But at this point in time, this is a pilot, so it's funded through the opioid settlement fund.
But $2 million is
1.1.
So many
It's
budgets.
1.1.
It's not gonna last till 2028.
It's per year, 1.1 per year out of the opioid settlement fund.
Okay, so it will last to 2028.
Yes, it will. Right now there are resources and anticipated resources in that fund that will continue to be used for this through the evaluative period.
Okay, thank you.
Welcome. Other questions from members? Thank you very much, Dr. Levine. And I do want to express my appreciation for meeting the timeline actually in the bill, which I know was an aggressive timeline, and for you and your staff to be able to do that, and for the input process that that you briefly elaborated on. I too received very positive feedback from the folks who participated in that process, in terms of the ability of the department to listen to the feedback and to respond. And the people who spoke to me about it definitely felt like they appreciated the process that you laid forth. So thank you very much for that work.
Great, thank you for that. And I'll remain on while Joe makes his comments in case there are other questions at the end.
Thanks so much. Okay, now we're going to move, as you saw, and if you've had an opportunity to look at last year's bill, this was a bill specifically allocating resources so that the city of Burlington could establish an overdose prevention site. And Joe, thank you. Mr. McGee, thank you for your willingness to be here today and to give us an update on what the mayor's office is doing with regard to entering into the agreement with the health department. What steps are you taking to implement this, and kind of what your timeline looks like?
Thank you, Chair Wood, and I thank the committee for inviting the city of Burlington to testify today. As you all start your work this session, for the record, my name is Joe McGee, and I am the Deputy Chief of Staff here in the Burlington Mayor's Office. So since H72, which is now Act 178, became law, the city has taken a number of steps to support the implementation effort on the city front, and I'm happy to walk through some of those today, and we will certainly be happy to return to the committee in the future to share updates as this work progresses. We did meet with the Department of Health, as Dr. Levine mentioned, in the late summer to provide feedback and discuss the guidelines when they were still in draft form before September 13th. And do just want to echo the gratitude that has been shared, that was a very collaborative process as we're all collectively working to figure out what an OPC looks like in Burlington and in Vermont, in implementing this new and critical life-saving intervention. We have also taken this step. Our Office of City Planning has drafted a zoning amendment, which will be small and tailored to the language in the legislation to allow for this pilot to be established in Burlington, as our current zoning ordinance does not have a definition that neatly fits with overdose prevention centers. That amendment was presented to the Burlington Planning Commission on August 13th, 2024, and will be brought forward for approval in late winter or early spring this year for approval by the Planning Commission and then by the City Council. And as Dr. Levine also mentioned, we did hire a special assistant on overdose prevention center implementation. That position was posted for hiring in early October 2024, and we hired Teresa Vizina. Returning members of the committee will be very familiar with Teresa. She is a longtime harm reductionist and a public health advocate who has spent many years working across the state of Vermont and in Burlington on harm reduction and running syringe service programs. She brings significant professional expertise and a deep personal passion for the work, and we're very grateful to have Teresa on the city team to support implementation of Overdose Prevention Center here in Burlington. Teresa started with the city on December 13th, and she immediately began developing a roadmap for this. And I'll just note that in the late summer, when we were having these discussions with the Department of Health and others about the city's role in implementation for the Overdose Prevention Center pilot, it was clear to us that we needed this additional capacity to support this work. And so it did take us some time to get the position created and posted, and to hire Special Assistant Vizina. So, I think we would have liked to be able to have made a little bit more concrete progress to date, but I'm pleased to share that since Teresa has joined, we have made significant progress, and that will be clear in the coming weeks as we release requests for letters of interest from potential providers. And that will precede a request for proposals, when we will ultimately select the provider in close collaboration with the Department of Health. We, at every step of this process, want to make sure we're doing this very intentionally. We will get to site selection once a provider is selected. That work will be informed by data and evidence. Knowing where overdoses are happening in Burlington, and knowing what we know about the effectiveness of overdose prevention centers within a certain radius. So all of that will be considered throughout this process. The request for letters of interest and the request for proposals will be developed in collaboration with the Department of Health and following the guidelines as required. So we don't have the letter of interest request posted just yet, but that is hopefully coming in early February. Teresa is taking a much deserved break right now after a long career with Vermont Cares, and she'll be back for that meeting with the Department of Health that Dr. Levine mentioned a week from today, January 21st. So there will be much more to share in the coming weeks, and I'd be glad to take questions from the committee.
Thank you, Mr. McGee. I appreciate that. I'm just wondering, and I suppose we will have Teresa on at a later point, now understanding she's the sort of formal point person. Is there involvement? Because I know that the city, particularly in the fire department and first responders, have sort of instituted a special response for overdoses within the city, and I'm just wondering to the extent that first responders will be involved in the sort of development and evaluation of, sites and potential contractors and things like that. I guess I'm hoping that that's an inclusive process that, involves people who have been involved with the response to date in the city.
Yes, absolutely, Chair Wood. Thank you for that. That is a large part of the reason why we made the decision to bring on the special assistant position, acknowledging that this will take a significant amount of coordination between city departments and stakeholders and interested community partners. That work is, implementation is definitely going to involve all of our first responders here in Burlington, getting their feedback on potential sites and how this new public health intervention will be incorporated into the services that already exist here in the city. And the program that you mentioned, I believe, is the community response team through the fire department. That
Yes.
was initially a pilot, started in FY24. We've continued funding it through FY25. That team provides outreach and overdose prevention leave behind kits with Narcan and test strips. And that team also helps connect folks to services. And I also want to note for the committee, while I'm not prepared to provide extensive testimony on this today, and I'm sure the fire department would be willing to come present on this, but I do want to make folks aware of the fire department's PREVENT initiative, which is a collaboration between the University of Vermont Medical Center, the fire department, the Department of Health, and others that allows for paramedics in the field to induct folks onto buprenorphine if they respond to an overdose call and reverse an overdose. They are able to administer buprenorphine in the field now, and that is a project that launched in recent weeks. So I will be happy to facilitate the fire department presenting on that at some point if it's of interest to the committee.
Thank you. Thank you. Appreciate that. Questions from committee members? Go ahead, Representative Bishop.
Thank you, Madam Chair. I'm curious, recognize that it's been just a month that Teresa has been on the job, but either in her work or otherwise, is there a timeline or a goal, I should say, at this point for when the hope is that the center will open?
I don't have a firm timeline right now. I think we have a lot of coordinating to do with the Department of Health to understand the flow of funding with the city's grant proposal to the department, ensuring that the city has the funding ready to support this pilot project, and ensuring that that's in place when we do put out the request for proposals, so that this is all able to move forward and we're not unnecessarily delaying things once a provider is able to be selected through that process.
So I'm going to ask maybe a little bit different version of Representative Bishop's question. And when do you anticipate having the city's grant request submitted to the health department?
I would anticipate that happening in February, probably in coordination with the release of the request for letters of interest.
Other questions? Okay, Representative McGuire.
This may be a little bit of a statement, but it will be a question involved with it. As we are aware, there has been a change in federal administration, and under the previous federal administration from 16 to 20, testimony was taken throughout many states in regards to implementation of safe injection sites, and testimony that was provided in many states by federal district attorneys that were in place specifically stated, and I will not use verbatim, but in regards to this committee, former federal district attorney Christina Nolan expressed that they would not turn a blind eye to this endeavor. We now have that change of administration back into place. My concern is that the incoming district attorney may not turn a blind eye to this endeavor. Does the city of Burlington or the state plan to reach out to that federal district attorney to get the insurance that if this is implemented, that it will not be put into harm's reach or i.e. prosecuted? We understand that these endeavors are against the Controlled Substance Act, and that's my concern. Does the state or does the city of Burlington have any intention to be reaching out to that new administration to check and whether or not this is a viable plan?
So I'm just going to intervene here just to say, one, we don't know who the new
That's correct.
person is going to be yet. And it's a little bit of cart before the horse. I understand your statement. And I think at this point in time, we certainly do need to be aware of the things that are happening in the environment in which we are operating. But I honestly think it's what I would say is too soon to tell in terms of, what we would expect the city of Burlington to reach out to, and how does that interact with the state law that's been implemented. And I'm sure that there will be a lot of discussion about that very topic, Representative McGuire.
I agree. Thank you very much, Madam Chair. I agree 100%. I just felt it was important that we kind of address the elephant that was probably going to be in the room at some point along the line.
I appreciate that. Thank you. Representative Steady.
I wasn't involved, so this is on, well, I know I wouldn't have voted for it, but anyways. So what is in place if somebody happens to die or have health repercussions about families suing the city or the state? Is there at your own risk paperwork signed so that we don't have potential lawsuits?
Representative Steady, I'm just going to refer you to H72 and the act that lays forth the legal provisions there. So you'll be able to take a look at that, review that, and then if you have any questions, we can certainly have legislative counsel explain them for you.
Okay.
Okay?
Thank you.
You're welcome. Okay, thank you very much, Commissioner Levine and Mr. McGee. Appreciate the update. We, as you can imagine, we will be staying in close contact over the course of the next few months. And Dr. Levine, it would be helpful if you could have one of your staff send us the link to the guidelines. Just sometimes web pages are a little bit difficult to navigate, and we will just share that with our members so that they can see the guidelines that are in place.
Not a problem. I suspect Ms. Weil, who's in the room, will have that done before she leaves the building.
All righty. Thank you very much. Appreciate your time and attention to be here today, especially I know, Dr. Levine, you were coming right from one meeting right into another. So appreciate the fact that you were able to accommodate our schedule this afternoon.
Thank you.
Righty.
Thank you all very much.
Okay, take care. Okay, committee, we have a few minutes at 2 p.m. Ray and I need to go to a training for the rest of the afternoon. So as do all the other chairs and vice chairs. So we know the legislature's on holiday from 2 p.m. The rest of the afternoon. But before we do that,
I see there's BAA material.
that's exactly is what we're going to do. I am going to. iPad is never as good as I would like it to be. Hold on just a second. All else fails, go to your email, right? Okay, so having a responsibility for a department, one of the things that we do in this committee that is different than some of the other committees, we have a pretty involved and intense relationship with the Appropriations Committee. As you may or may not know, the Agency of Human Services is the largest state agency in state government and is, has the largest budget in state government along with Education Fund. They kind of go hand in hand, roughly around the same amounts, I think. So we have 3 specific departments that we have jurisdiction over. That's the department. We did this in our trivia. Sorry, Ann wasn't here to do the trivia because you would have been on the winning team, I'm sure. But we have Dale, the Department of Disabilities, Aging and Independent Living. We have the Department for Children and Families, and we have the Vermont Department of Health. So I have assigned what I call their department leads, and they're department leads around the budget, but they're also really around keeping track of the policy that's happening and the changes in those particular departments. So you will get to be good friends with the people who are in those departments, and they will get to know your names very well, as will the advocates around any issue that is involved with those departments. So I'll send this out to you, but I just wanted to review the assignments that I'm making. So first off is for Dale, and the lead is going to be Dan on the Dale, and Todd, you and Dan will get to know each other real well, working on those issues. Again, that's issues around older Vermonters, people with developmental disabilities, people with physical disabilities, brain injury, voc rehab, or they call it hireability now, but all of those issues will be under Dan with the lead, and then Todd. The Department for Children and Families, very large department. Okay, so we've broken it up into 3 areas. The Child Development Division, the lead is going to be Ray, and Doug, you'll be working with Ray on child development. So that is our Act 76 and our child care implementation. It's also early intervention services. There is some crossover work with the health department on home visiting and things like that. So the 2 of you will be taking care of that. Then we have DCF Economic Services / Office of Economic Opportunity, and Jubilee is going to be the lead on that. And Esme, you'll be working with Jubilee on those issues. So that's there's a lot in that. There's weatherization, there is emergency housing, there's shelters, there's a whole host of things in that area. And then we have DCF in Family Services Division, and Anne will be the lead on that, with working with Brenda. And that is really around child welfare and juvenile justice. And we will have a lot of discussion around juvenile justice in the next 2 days, because we're going to spend pretty much most of the next 2 days hearing testimony on juvenile justice. There's a lot to unwrap in that, and Anne is been following that very closely and will be an excellent lead. And Brenda, you'll learn a lot from Anne. Let me tell you.
Their department that they're going to be working on,
Right.
I can tell you a lot of waste.
Right. So that's why you're in a different department. That's why you're in a different
Share
division.
with you.
Yeah. Okay. And then we have the health department, and Eric is going to be the lead on the health department, working with Zon. Health department, you already know about the substance use services division, but we also have maternal and child health. We have public health. It's broader than substance use. So they're looking at all of those, and there will be some interaction with our health care committee, because they also share jurisdiction on that. So we'll figure out who they're going to be assigning for that, and then we'll work on that. Now, downstairs in appropriations, just before lunch, they all got their budget assignments, and I had a chance to review those with Chair Shai, and she will be sending that up to us. So I'll share that with you when she does. So it's pretty much all new partners. You'll get to be working with people who will not be the policy. We are expected to be the policy experts on these areas, okay? The Appropriations Committee is expected to understand what are the implications of a budget adjustment. So we will be diving into budget adjustment. It'll give you sort of a chance to dip your toes into the water and get a feel for what it's going to be like in budget. When we say budget, it's not only looking at the numbers, but it's also looking at language. So the administration submits language that impacts or has the potential to impact the programs and services of the various departments, and then therefore also the Vermonters in general. So we're going to take a look at that. We're probably going to actually go over the BAA in committee, which is because we have so many new members, and we will kind of go through, what the budget documents look like. We'll get somebody from JFO to kind of come through and walk us through that. We will, depending upon, I haven't looked at all the areas yet. So depending upon how much or how little involvement we have in terms of what they're looking at to adjust, we will have the department representatives in to testify on that. And then the budget teams will meet individually with departments. And depending upon if there's advocacy involvement, there usually is advocacy involvement on most everything. So, you know, you will be hearing from folks now that they know, because everybody's listening to this, now that they know who has been assigned to what department and what area of the department. They will be contacting you to put forth their FY26 requests. Not all of those people will come before this committee because there are many of them and we don't frankly have the time to do that. But as individual teams, you will be given work time within the legislative day to meet with advocates, to meet with department members, and you will formulate recommendations to bring back to the committee. And then the committee will, we try to reach consensus on this. The committee will ask questions, might ask you to go back and get some more information, or might just, you know, agree with what you have, or there might be disagreements. We don't know. It all depends upon what comes out of your work. So, so part of it will be sort of like you're doing the sleuthing, you're doing the, you know, asking the questions that are the more detailed questions, and then you'll come back and make presentation to the full committee. From there, we make our recommendations to the Appropriations Committee. And that memo that we write has a lot of weight in the Appropriations Committee because they rely on us as the Policy Committee to help them understand what we believe are the important investments to make, or the important places to reinvest or to shift investments. So all of those things. So that will be what's coming up in that regard. And like I said, the BAA is an opportunity for you to kind of get used to a little bit, sort of the notion of looking at budgets and thinking about asking questions. And all of the people who are leads, with the exception of Eric, he hasn't done it in this committee, but can already tell that you've got an evaluative mind and you'll
I'm gonna say, give us the money.
yeah.
Or else.
Or else, oh gosh, already. And I am a resource to each team. So do not hesitate to, you know, if you're stuck on something or you're not sure what something says, I might be able to help you figure it out. I might be able to kind of send you in a direction to find the information or to talk to certain people to get the information. So don't hesitate to reach out if you're feeling stuck or you're just feeling like, I thought I knew what I was doing, but maybe I don't. And so, you know, feel free to reach out. I might not know the answer, but we'll figure it out together. Okay. And as I said, don't be overwhelmed with the fact that there will be a lot of people now contacting you wanting to bend your ear. Yeah.
Thank you. I just want to also mention that Teresa mentioned that not all the departments might come and testify before us, but they will all present their recommendations to appropriation. So it's a good practice to watch their agenda to find out when your folks will be in that committee, so you can watch it on YouTube, or if you can sneak away and be able to answer questions.
Yeah, and depending upon what we're doing here, you may be able to sit in on their testimony and listen to the question and answers. Sometimes that's hard to do going back on YouTube sometimes. So, if you want to do that, you feel you need to do that, just let me know in advance so that, like, we can't have everybody disappearing all at the same time. Yeah, go ahead, Doug.
Will those folks from the departments give us a heads up? Oh, you know, Doug and Ray, we're going to be over in appropriations.
You have to watch.
You have to watch the
their
appropriations agenda, yes.
And then with respect to the memorandum that we're going to put forth ultimately for appropriation, what's the timeline on that?
We will hear from appropriations about their request and their deadline. They let us know when we need to get feedback back to them by. They have not. At the Democratic caucus this, I guess it was still morning, yeah. There was Representative Shai said she anticipated about 3 weeks that they would have the bill out onto the floor in roughly 3.5 weeks. And so that means that we will probably have roughly 2 weeks to complete our work, counting this week.
Sorry, another question for clarification. So you referenced the memo, so that's in connection with the budget adjustment. Is there another memorandum that they will ask for the larger appropriations process?
It'd be larger and longer.
Yes.
Yes.
And the time, it's not bigger, that is again, something that they will share with us. Is that a crossover, have any relationship to that?
Oh, yes. Yes, it does.
Okay.
And the money, so you know, the money, bills have an extra week. So policy committees have to get their things out by the crossover date, which I don't, does anybody know, off the top of their head? I don't.
Meeting time, I don't.
Yeah, it's usually like the week after we get back from town meeting. And then the money committees have an extra week in order to get their stuff out. But they have to deliberate and they take testimony on our recommendations. So, so we have to, you know, sort of back that up. So we will, in all likelihood, have to have our stuff done before we go on town meeting break. And that's actually probably good for us so that we don't have to be thinking about it on town meeting break, but, so sort of keep that in mind, but, we'll wait and see what we hear from appropriations in terms of timeline.
Thank you.
Yeah, go ahead.
When do we meet with our teammate?
You and Ann can get together when after we're done here, which is in about 30 seconds. And
All these little time windows that pop up.
Yeah.
At lunch.
Wondering when we talk, yeah.
Okay, thank you. Oh, it's on the back. The link, just the link.
Yeah, that's fine.
Yeah, that's good. All right. Okay, so that's it for today. We'll see everybody. Just, reminder, tomorrow we are going to be at 9 a.m. across the way, in the, Pavilion Building upstairs in room 270. So that's off the main big room. It's just right there in front of you. So, where's that one around the corner?
It's around the corner.
Yeah, it's around the corner. I just thought of that. Okay, so,
We'll
yeah.
have signs or something.
Yeah. I just remembered seeing the sign for 270 and pointing in that
Yeah.
direction. So, yeah. So we are going to be there, for the next day and a half. Okay, so, you know, I will say we did try to, figure out some way to transport people there.
I did it today. I struggled, but I sat and it calmed down.
Yeah, and Brenda,
Either
you're
my
up.
heart or my breathing, I haven't figured it out yet.
Yeah, I get that.
I did it, so I can do it.
Yeah, I just, thank you. There are other people with issues as well, that, you know, we want, anyways, I've asked for it to be on a leadership agenda because, we need to accommodate, we need to be, accommodate, you know, the needs of people in ways that we can. And we used to have a way to do it. And now that way we used to have a little, the Capitol Police used to have a little like, mini thing that they don't have.